Hello everyone, and welcome to our virtual educational program. In this module, we will be discussing Alzheimer's disease. Alzheimer's disease is the most common type of dementia. According to the National Institute of Neurological Disorders and Stroke, Alzheimer's disease is a progressive, neurodegenerative disease that occurs when cells in the brain die. As Alzheimer's disease involves parts of the brain that control thoughts, memory, and language, the following behaviors are often associated with Alzheimer's disease: impaired memory, thinking, and behavior. Other symptoms include confusion, restlessness, personality and behavior changes, impaired judgment, impaired communication, inability to follow directions, language deterioration, and emotional apathy. As such, it can seriously affect a person's ability to carry out daily activities and engage in their meaningful occupations. Given the many symptoms associated with Alzheimer's disease, the well-being of the individual and that of their family can also be affected. What is known about Alzheimer's disease? Scientists do not yet fully understand what causes it. However, they hypothesize that there is likely not a single cause. Rather, several factors affect each person in a unique way and may contribute to the development of Alzheimer's disease. Among the risk factors are the following. Age. This is the best-known risk factor for Alzheimer's disease. Family history. Genetics may play a role in its development. However, a healthy lifestyle may reduce the risk of developing it and can slow down its progression. Lifestyle. There's growing research indicating that healthy behaviors, which have been proven to reduce risk of other conditions such as diabetes and heart disease, may also reduce the risk of cognitive decline in Alzheimer's disease. At this time, there is no cure for Alzheimer's disease. The disease progresses as nerve cells in the brain are damaged and can no longer function as they used to. Physical exercise, cognitive and social activity are most important in its management, as are proper nutrition, health maintenance, and a calm and well-structured environment. Occupational therapy has a role in the treatment of Alzheimer's disease, as this discipline is focused on improving quality of life through maximizing engagement in activities, creating safe environments, improving emotional well-being, simplifying tasks, and maintaining existing abilities for as long as possible. The American Occupational Therapy Association identifies 4 strategies that can be used for people with Alzheimer's disease. First, modification. This is the most frequent form of therapy for memory loss patients. Through adaptation, personal assistance, social supports, and verbal cueing, therapists can create safe environments for people to live independently. Second, maintenance. Therapists can creatively provide practical support, such as using signs on doors or having only seasonally appropriate clothes in the closets for everyday routines. Third, health promotion. As mentioned previously, it is very important for people with Alzheimer's disease to engage in physical activity. Occupational therapists can help with maintaining physical strength and, additionally, can provide treatment ideas to improve cognitive awareness and emotional stability. Lastly, remediation. While occupational therapists are not able to restore cognitive abilities that have been lost due to neurological degeneration, they can use cognitive and physical exercises to help improve the daily lives of people with Alzheimer's disease. Let's look over a clinical case. Mrs. Clark is a 75-year-old woman recently diagnosed with Alzheimer's disease by a neurologist. She lives with her husband of 50 years in a 2-story home. Mrs. Clark used to manage the family checkbook, sang in the community choir, and enjoy taking care of her 5 grandchildren. However, her family noticed that she gradually stopped returning calls and was late or forgot about her choir practice. Additionally, although she continued to perform her daily self-care tasks by herself, her husband noticed a decline in her ability. Her primary care physician referred to home-based occupational therapy to promote safety and functional performance at home, and also to provide caregiver education. In fact, Mr. Clark, who is the primary caregiver of his wife, indicated that he was mildly depressed and reported poor quality of life. The occupational therapist working with the Clarks found strong evidence for several intervention approaches. First, activities of daily life training and activity modification to improve performance and independence. Mrs. Clark was advised to purchase a raised toilet seat and tub bench to increase safety in the bathroom. Additionally, Mrs. and Mr. Clark were instructed to reduce clutter in the bathroom, kitchen, and bedroom by setting out only items that are needed. This helps reduce activity demands, confusion, and agitation. Second, errorless learning, which is practice of a task by preventing mistakes and ensuring correct and consistent sequence. This can be done through using simple instructional cues, communication strategies, and guiding for proper hand placement during transfers, such as in and out of the shower. In the case of the Clarks, the therapist practiced safe transfers with their new bathroom devices and provided Mr. Clark with the opportunity to perform several repetitions. Third, ambient music and multisensory interventions. The therapist included soft lighting and quiet ambient music during Mrs. Clark's morning routine in order to decrease her tendency to become agitated. Fourth, exercise-based interventions to help improve performance, maintain functional mobility, and improve sleep. Given Mrs. Clark's interest in gardening, the therapist utilized her meaningful activity to engage in physical activity. Fifth, monitored devices to prevent falls in the home. Mrs. Clark was provided with a bed exit alarm to address her tendency to wander at night and to prevent falls. And lastly, Mr. Clark was provided with psychoeducational interventions for his own physical, mental, and emotional well-being. Finally, here are some tips you can include in your daily life. Try to keep a routine, such as bathing, dressing, and eating at the same time each day. Help a person write down to-do lists, appointments, and events in a notebook or calendar. Plan activities that the person enjoys and try to do them at the same time each day. Consider a system or reminders for helping those who must take medications regularly. When dressing or bathing, allow the person to do as much as possible when safe. Buy loose-fitting, comfortable, easy-to-use clothing, such as clothes with elastic waistbands, fabric fasteners, or large zipper pulls instead of shoelaces, buttons, or buckles. Use a sturdy shower chair to support a person who is unsteady and to prevent falls. You can buy shower chairs at drugstores and medical supply stores. Be gentle and respectful. Tell the person what you're going to do, step by step, while you help them bathe or get dressed. And lastly, serve meals in a consistent, familiar place and give the person enough time to eat. Thank you for your attention during this presentation. We hope the information in this video was helpful to you.